Hi everyone, it's Myran. The article that I am critiquing for our journal club discussion is called Assessing and Improving the Knowledge of Sexually Transmitted Infections Among High School Adolescents. The objectives of the study are to assess the impact of an interactive scenario-based presentation about sexually transmitted infections and dermatologic skin manifestations in high school students, and to evaluate students' baseline and acquired knowledge about common sexually transmitted infections using a before and after survey. This study is important because according to the CDC, half of the 20 million new sexually transmitted infections occur annually in youth ages 15 to 24. It is critical to be able to provide young patients with accessible education about how to identify, prevent, and treat these conditions. So the study design included identical and de-identified pre- and post-intervention surveys with 10 multiple choice questions, 2 focusing on demographics and 8 focusing on lecture content. These were given to participating high school students in a health education curriculum. Prior to performing or doing this presentation, consents were obtained from the students' parents beforehand, and they were allowed to opt in or opt out of the presentation. The lesson content highlighted the most common STIs, major signs and symptoms of STIs, treatment of STIs, and complications if left untreated. So during their scheduled class time, the students first completed the before survey. They were given 10 minutes to do this. And then they viewed the interactive 25-minute long PowerPoint, which was a live presentation lesson. And when that was done, they took the after survey and once again were given 10 minutes. Each content question was worth 1 point for a total of 8 points for the before survey and as well for the after survey. The sample size included 11th graders, there were 57 of them, and 12th graders, there were 16 of them, and then one student that didn't identify whether he or she was in the 11th or 12th grade. So there was a total of 74 students in the sample. Utilizing SAS Studio 3.8, they analyzed the results of the study using pair sample t-tests comparing numerically rated answers on the before test and after tests. The significance was set at 0.05 for all two-tailed tests. The outcomes, so the mean age of the participants was 16.48. 95% of the students had heard of STIs before, 4% had never heard about STIs, 1% stated that they do not know about STIs. The average percentage improvement in scores was 185% for 11th graders from the pre-test to the post-test results. The average percentage improvement in scores was 125% for the 12th graders, comparing the pre-test to the post-test results. With regard to sources where students stated they had received information about STIs, the majority identified that 91% was from school, 72% was from the internet, 60% was from family. Overall, there was a mean improvement of 1.85 points in their post-test score as compared to their pre-test score, with a standard deviation of 1.58. For all participants regardless of grade, the mean pre-test score was 1.07 and the mean post-test score was 2.92. The findings of the study found that a low score improvement was found for the question regarding the main signs and symptoms of STIs, with a mean pre-test score of 0.44 and a mean post-test score of 0.58. A low score improvement was also found for the question regarding human papilloma virus treatment, with a mean pre-test score of 0.05 and a mean post-test score of 0.14. Many young adults are unaware of the common types of STIs, symptoms, and potential complications. Half of the annual STI cases in the United States occur in adolescents and young adults. It was also found that social media and text messaging may be promising approaches for effectively increasing STI knowledge among both young women and men. One of the strengths of this study was that it was conducted as part of the health education curriculum in collaboration with educators at a suburban high school. This helps because this particular high school has a class focused on sexual health education for adolescents. It was also a strength that parents were notified in advance and were given the opportunity to opt their children in or out of the presentation. Some of the limitations included that it was a small pilot study conducted at a single site. Educational institutions have different requirements regarding presentation and format of sexual education topics. It was also a limitation that there were a significantly amount of grade 11 students compared to the grade 12 students. This study also did not assess how gender may affect study results. The significance of the study include that although there are limitations to the study, the results showed improvement from the pre-test and post-test after the 25-minute presentation was conducted. This information may be used to refine and modify the content and delivery of the information presented, including gathering feedback from the participants on how it could be improved.